today is officially the 2-year anniversary of the World Health Organization declaring the pandemic. I know that in New York, it was March 13th, I believe, that we totally shut down 2 years ago. And we're in a very odd place. I just went out and did my first live show in those 2 years. But at the same time, I also know that in New York, in the tri-state area, we're starting to see a slight uptick from the Omicron second variant. And, you know, it remains to be seen how much traction that gets, because people are going to start being able to go outside more. But also, all the masks are off. I mean, for the most part. This event I went to, I'd say about 70% of people wore masks. Just your thoughts about this, and particularly since we just passed a budget where there's no COVID money, and they're going to go back to it. But we're in a weird place right now.
Yeah, we are. It's kind of depressing, really. I wrote about this for Salon this morning, this whole idea that, you know, we're 2 years in, and what it's told us about our culture is, to me, really disturbing. I mean, it's disturbing. And, you know, and about our politics, to be honest. I mean, yes, we are in a position now where, it's obvious that the Omicron surge, our latest surge, we've had 3 of them so far since in the last 2 years. This one, you know, rose very quickly and has now receded very quickly, which is great. And I think everybody's happy about the idea that we're now going out and being able to, you know, be free, more or less again. And I don't think anybody argues with that. But the Sturm und Drang that has gone along with all of this, with the government response, with trying to get people to you know, behave in some kind of a collective way. And I mean, I think that, you know, my piece was about this idea that somehow or another it exposed the fact that our already fragile social contract was really broken. And we can see that with the way that our politics sort of intruded on something that was a national emergency, a crisis that hit every single person in the country. And so we couldn't come together enough to do that. Right now, outside of Washington, D.C., you've got a bunch of truckers going around in circles outside the Beltway to protest vaccine mandates, which there really aren't any other than individual businesses that are doing that. But you know, for the most part, there's certainly no federal vaccine mandate, and yet they have found this as some kind of a motivation, an inspiration to get together and hold this protest for something that doesn't exist around something like COVID. And to me, I mean, I think you remember when we went through the Obamacare wars in the Tea Party and all that, the protests that happened around, trying to provide affordable health care for people. And you could see it there. There's a faction in our culture that is just so kind of fanatically individualistic that they're willing to die and have other people in their lives die rather than join with their political enemies or people on the other side in their minds, even for something like that, even for something like this, where people, and as a result, now we're looking at almost 1 million dead, and it's probably going to exceed that before this is all over, a number that's was unthinkable. I mean, you remember Trump said back at, 2 years ago, if we get to 70,000 people, it's not going to go any higher than that. And, literally we're almost at 1 million deaths and counting. All it did was basically solidify the opposition and the hostility toward any kind of mitigation and and vaccination, which would even help, themselves, which would keep them out of the hospital. So to me, this is a depressing moment because I realized something about our culture that we have a culture war here, and there are almost 1 million dead in that war. That's how I look at it. And at least they say that at least 300,000 or 400,000 of that million were unnecessary deaths because of because of the opposition to vaccines and what have you. So to me, it's kind of it's a big bummer.
We're seeing obviously deaths are happening around the world, but the death rate that we have here, I mean, and it's, the other thing that is astonishing to me, I mean, I guess I'm not as, I guess maybe it's just because we're 2 years into it and I've gotten used to the idea that there is a significant portion of the country that is just sort of, I'm going to be against vaccinations just because, I mean, in many respects, or I'm going to be against, sort of believing in COVID because, I think, look, the right has been on an extended project back when I wrote that FUBAR back in 2006, we quoted, I think it was Gertrude Himmelfarb, who was, Bill Kristol's, I think, mom, talking about attacking science because we don't want there to be some type of objective reality. I mean, this was part of and parcel of a conservative project. Mm-hmm. What I think is also to add to how disturbing things are, we're 2 years out. We have no way of really assessing the impact of long COVID. We have no way of really tracking the implications of things like, these new variants. I mean, we haven't set up, the amazing thing, I guess what I'm trying to articulate is we haven't set up any type of apparatus to deal with the potential of another wave. Like, after, Delta was a complete shock to everybody, I think. And I will have to say that, one of our guests, one of our regular guests, Dr. Mark-Elaine Derry, said to me in April of 2020, I said, what is it that scares you the most about this? And he said, COVID 2023. And the idea being that he knew there was potential for these variants to be rolling around. Didn't know what they would be called. But there does not seem to have been, we don't have apps to do any, contact tracing, and we don't have any. We have no system that has been put in place that we could fire up in a moment. We've got on Flatbush Avenue, there's like about 12 vans that will do COVID testing, but you go in and the PCR tests come back 5 days later, 6 days later. They're useless in that regard. And they're just basically scams now, it seems to me, for the most part, because you can get an antigen test, you can buy one. We should have, they're handing them out free through the government. And you can get a second round of those, incidentally, now. You can get your second 4 because nobody's bothered to get them for the most part. But we haven't created any systems at all. And we're 2 years into this. And I don't know, it's possible Omicron, baby Omicron comes and is as problematic as Omicron is. We would have a better sense of how dangerous it is if we had set up apparatus for this. But there's nothing. I mean, and I think it goes to your point that maybe it's about the right on some level. Maybe like there was just too much of a resistance there that couldn't be overcome when people are exhausted, but it's really disturbing. And it shows, I think a failure. Just going back to, things like Reagan and Clinton saying, the era of big government is over. I mean, it's just the attitude that's been created by our politicians.
Absolutely. And all of this mistrust in the institutions, the institutional failure, which I think is, that's undeniable. The CDC and the rest. I mean, remember back in the beginning, they had to develop their own test. And so, we got way behind the curve on that. And our politics have just become, the culture war uber alles here. It's all about the culture war. And that has, infected everything that the government does. And just this week, and this has nothing to do with Donald Trump or anything, the Congress had to remove the COVID funding, as you mentioned, from the big omnibus funding bill. bill because, well, first of all Republicans were against it, so that there was no crossover on that. And then because they were having to pull money back from certain states, apparently the deal that they'd struck to get perhaps the 10 senators they need in the Senate to overcome the filibuster on the omnibus, they had to make a deal that they would pull back money from certain states that had money left over from earlier COVID. That upset certain Democrats who were from states that they were going to lose money, places like Washington and I think Michigan and some others. So they came in and said, no, we're not going to go along with that. So in order to get the omnibus bill passed, which they had to do, there was a deadline, they removed that. Now, to me, this is the most short-sighted thing I can imagine. It's just as you say. I mean, there is absolutely no guarantee that there's not going to be another wave. If anything, most of the epidemiologists, I mean, I have one of those lists on my Twitter feed, that you follow all these scientists. I check it, every day, and they're all going, this is crazy. Of course, it is almost guaranteed that there will be another wave. And yes, we have certain abilities now. The vaccinations make a huge difference. We sort of understand that we need certain kinds of masks in those situations. We've been through it enough that maybe there's just sort of a muscle memory on how some of the institutions will react. But as you say, there's no system in place, and apparently, after all we've been through, there doesn't seem to be even any appetite for creating one, as far as I can tell, among the politicians. I mean, this just seems weird to me. Look what they did after 9/11. I mean, I'm still taking off my shoes to get in an airplane. And there's been no reassessment of any of that, terrorism, stuff. So what is it about this? What is it about COVID that makes people unable to grasp that this is a new world here we're dealing with?
I have seen a couple of people on Twitter, and I certainly came to this feeling too, that, one of the things that I remembered 2 years ago was this sense of people started paying attention to the 1917 flu, right. And realizing wow, that thing was more or less erased from our history. I mean, there seemed to be no appetite to talk about it. Even if you crack open a couple, and I did a couple of books about it, almost all of them. The preface or the first chapter is, this is a story that's barely told, and no one taught it, and I think to some extent there is some I think, and I don't know if this is taking place in other societies, but I think there is some sort of human reaction, which is, I'm going to ignore this because I can't. I mean, you look at how much the Biden administration now, it seems to me, is guilty of this too. We're going to will COVID away. Right. We've decided it's over, so it's over. And I think that's a human response to can't do anything about it. This isn't, and who knows if earthquakes lasted for 2 years, if tsunamis lasted for 2 years, or a year, let's say, or a hurricane lasted for a year, maybe at one point you would just be going to just ignore it. I'm just going to ignore it. I'm going to try and ignore it. And I'm going to walk out. And if I can't swim through this, then I'm done. I think this is just a natural, a natural phenomena that at one point human beings just, I'm going to pretend it doesn't exist because I can't control it. And
yeah, I think you're probably right. But I do think, one of the things that has made all the difference, and we really can't forget this, is the vaccines, which are medical miracles. It has changed everything. If they had been unable to do that, if they were dealing with a situation like HIV, which they still don't have a vaccine for, and struggling to find some kind of medical interventions that would help, it would be beyond, our capacity to deal with. It would be many, many millions of people. There are millions of people all over the world, but it would be a global catastrophe that's unmatched. So, let's thank our lucky stars for that. I mean, I'm absolutely, I'm very, 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 happy and grateful that they were able to do that.
Have you seen any numbers that would tease this out? I mean, it's sort of hard to compare apples and oranges, how people's behavior would have changed had they not been vaccinated. But I mean, we can just look at this. I mean, I think we're down to about close to 1,300 deaths a day right now. But we were up well into close to 3,000 again during Omicron, and Omicron was that much more contagious. And without the vaccines, we could be in this country at 5-6 million deaths.
I think so.
And I just was thinking about this today, that day that I got my first vaccination. Like, if somebody had told me, look, you're going to have to come in every 4 months for this, or every 3 months for the shot, I would have been like, okay.
Me too. I'm still okay with that. If they tell me tomorrow that we've all got to get a whole new series of them, I'm ready to go. To me, that's one of the things that I find so disturbing about this, is that we have this medical miracle. We have a lot of them. I mean, the treatments that are coming down the pike, the monoclonal antibodies and all that stuff. I mean, this is all super, super advanced, sophisticated medicine that's just come online like that. I mean, that we were able to do it. It's the one huge success story of this whole thing. It is the one thing that we can look to. And by the way, it's the most important thing. So, grateful for that. Thank you. But, I'm totally prepared for the fact that this is going to be a part of our lives going forward. I mean, everybody says that, this probably isn't going to be the only pandemic. There may be something even, completely different that's not a coronavirus, or not, it isn't, COVID, an offshoot of COVID-19. There's all kinds of things that are going to happen. And, to me, what it should have done. I remember when I was growing up, my parents went through World War II. So, and the Depression. So, I heard those stories growing up as a kid, and there was always this idea. Now, maybe it was BS. It's entirely possible that they were fooling themselves, and that there was this kind of political, back and forth during those crises. Among regular people, I'm not talking about politics at the high level, but just average folks are, having, screaming matches in each other's faces all the time. But they all said, no, the country came together, World War II, let's Rosie the Riveter, we all pulled together and did what we had to do. And granted, it's World War II, and that's not the same thing as a pandemic, but nonetheless, that idea that in a crisis that the country pulled together and that this is what you do. And, I sort of think that, maybe it was BS, but I know for a fact it didn't happen this time. I mean, in the beginning, there was all that, we were singing for the healthcare workers and going out and clanging pans every night at a certain time. I mean, there was a period there where there was this sense of, we're all in this together, but that fell apart very quickly.
Well, and that sort of felt like we were just like, if the Italians are doing it, we should probably do it too. I mean, there was
exactly.
But also, I mean, you remember 9/11?
Of course.
In that situation, to the extent that the country came together, which I don't think it really did, to be honest with you, but maybe a brief period of time, it was also it was an intimidation. Right. I mean, there was no for dissent. And there was a brief period of time where conservatives pretended like they cared about New York. And that didn't last very long.